Hello again, it's Harry here, your geriatric nurse from Toronto, Canada, back for my humble contribution for the care for the older adults and their caregivers. Tonight, I just wanted to briefly discuss about Foley catheters, as I've seen a lot of them recently. With the older adults, when it comes to treatments and anything that we will add as intervention, usually less is more. So having said this, if one is contemplating a Foley catheter, especially for chronic use, you have to really make sure that you are doing this for medical reasons and not just out of convenience. For example, and if ever it has been decided with the primary doctor or a specialist like a urologist, um, a regular reevaluation for its early reassessment of its actual need is needed. And because we want to do that because of the triple D's, again, delirium, depression, dementia, because anything you add to in the older adult's body could be a potential delirium cause. So for example, it can cause infection because of especially if you are using it chronically. But don't get me wrong, there are times when you need chronic catheter use, but again, it has to be done alongside with your doctors. And also, if it's something new for your loved ones and there is a urology appointment, make sure you take your loved one to that appointment, because again, you want to make sure you are reevaluating if your loved one really needs it. Um, and while someone has a catheter, make sure you monitor it continuously for any bleeding, any unusual discharge, any pain, anything like that. When they have it, also the positioning of the catheter is something very important so that you can prevent backflow of the urine, because when there's a backflow, again, there could be infection. Monitoring of the output, if there's any cloudiness, any foul smell, anything like this, any bleed, could indicate infection or any other medical condition. So it's very important you bring it to your doctor's attention or your primary care provider. Um, when you are dressing your loved ones, or if they are getting dressed, make sure that it's not kinked in any way and there's no chance for it to backflow, by making sure that the tube and the bag is lower than the actual bladder. That's it for now. Hope you guys are well and that 2026 will be blessed with happiness, good health, and all things that are great. Thank you and see you next time.